Good morning, everyone. Thanks for joining us today. If you don't know, I'm Matt Greco, the events manager here at Life University. And today we're very pleased to have Laura Rudinsky, the executive director of the Concerned Home Managers for Elderly Home Care.
And welcome everyone. And so, yes, I just want to make sure, because always people ask, it is a lot of information. So I did share with Matt a PDF of this presentation that I'm about to share so that you'll be able to have that information afterwards and review it. But I'm also always happy to take phone calls or emails, and my information, I'll put it in the chat as well towards the end, but you're always welcome to call. And what I'll need to do very briefly is to start the slideshow. So hold on one second. Okay, very good. So again, let's see. Okay, so again, I have worked in Medicare, Medicaid, and private pay home care for many years. So I'm going to be using that expertise that I have to talk a bit about the different types of home care. But I'm also going to talk a little bit about dealing with some of the resistance that comes up sometimes to the idea of having help. We'll talk about the question that we always get about whether using an agency versus hiring privately. Some questions you might ask about researching agencies, as well as how to go about finding the best caregiver. So I'm going to start by talking about the most common type of home care services, which is those that are provided through Medicare. The wonderful thing about those is that they're free, right? Medicare covers those services. They are only available, though, after what is called an acute or sudden need, meaning that there's a big change in functioning that causes a hospitalization, or it's either that you receive the services after you're in the hospital or after a rehab stay. They are provided through agencies called certified home health agencies. There are a few very large ones like Visiting Nurse Service, Northwell, but there's a number. I am a little bit New York City focused. I understand there may be people outside of New York City on the call, so I do apologize ahead of time because especially when we talk about Medicaid, it will be a little bit more New York State focused. But at any rate, there are such agencies nationally all over. The main thing to keep in mind is they're short term. They are always going to be 30 days or less, and it's not uncommon for them to be 2 or 3 weeks long in service. They are going to be really focused on the skilled needs, meaning that they're looking at making sure that you have nursing, physical therapy, occupational therapy, those rehab services that are going to help you to transition from having been hospitalized or in rehab to being up and back to your former self to the extent possible. So they really only provide a small amount of home health aide hours. Typically, in New York City, what we're seeing now is three days a week, 3 hours per day, just for 2 or 3 weeks. And usually it is set up by the discharge staff at the hospital or rehab. They'll be recommending agencies to you. If you feel that you need further care, in addition, they also always have lists of licensed home care agencies to access. And I am on my slides as we go along, will include some organizations that can provide further information or advocacy. In terms of Medicare home care, I really highly recommend the Medicare Rights Center to provide further info, or if you have a specific problem, giving you guidance on how to deal with it. So it is, as I said, a very short period of time. And generally they will, let you kind of have, based on your diagnosis, that you've met the outcome measures that they wanted to see. And as I said, it will usually be just for 2 or 3 weeks that you receive those services. Again, there's a lot of information here. I do encourage people to put questions in the chat, and I will take a few minutes, maybe in between, to see if there's any questions before going on. But we will certainly have time at the end for more for more Q&A. So since that is so short term, people ask, well, what else is like covered through a government source that I can access? And the answer to that is going to be Medicaid. All Medicaid home care services, and again in New York State, are provided through managed care programs. These are the income and asset levels currently. Which again, not so easy. And so I'm going to talk a little bit about how to deal with that. The one thing I want to emphasize is I could do a 3 hours or more just on Medicaid home care. I'm just kind of giving a thumbnail sketch because I want to kind of be able to let you know within the general area of home care how Medicaid fits in. But Medicaid applications are complicated. It's really helpful to have some guidance to do them, and I'm going to give some resources on another slide about that. If you fit into the asset level here, but not the income level, and that's understandable because cost of living is quite high in here. It's possible there is some loophole called a pooled trust that can be used as a tool, and I'll speak a little bit more about that. Another option that you should be aware of that is provided through Medicaid is the Consumer Directed Program. So, okay. And so sorry. So just staying with that, Consumer Directed Program is a program under which you are able to hire your own caregiver. So it could be a family member, even a friend, someone that you know well, or who has had, some training in providing care. But it is, again, and I know people sometimes they'll see the ads in different places and think, oh, I'd like to get that. But it is a program that is part of Medicaid and provided under the Medicaid program. The one thing that you should keep in mind is while the advantage is the flexibility of hiring whoever you want to provide the care, someone needs to take the responsibility on of supervising, hiring, and all of those other pieces that go into making sure that the care is appropriately given. So in terms of doing a Medicaid application, really, and many of us do have complicated financial situations, it's really best to consult with an elder lawyer. Medicaid law is very complicated, and even though it does cost some amount of money, some at least a few $1,000s, it can really be worth it in terms of making sure that you're able to access the services. Other agencies also, sometimes that aren't lawyers, have social workers and other staff that can do Medicaid applications for a fee. In New York City, Department for the Aging case management agencies also can assist with simple Medicaid applications. In the different boroughs, there's different case management agencies depending upon your neighborhood. And Department for the Aged gave contracts to different agencies to provide those services. But you can access 311 in order to find out your local agency if you don't know them and speak to them about it. Their pooled trusts also will assist with Medicaid applications as well as the pooled trust, again, for a fee, and then with the expectation that you would be making use of them. One other program, and I will say it again, it is a complicated one, but good to know about, is called the Nursing Home Transition and Diversion Waiver Program. So as per its name, the reason that this program came to be was that the state as well as federal funding came through to provide additional services to people with the idea that they either are in a nursing home or were at a level at which they could qualify for nursing home care. And that if they just had some more services beyond what Medicaid usually provides, like maybe a little case management help, some higher hours of home health aide service, or other assistance. I think even housing vouchers that therefore the person would be able to transition from the, and be able to stay, either transition from the nursing home or stay in the community. You do need to go on to Medicaid first before applying for that waiver. And it does take 3 or 4 months to do that application. It is a complicated application, but it's something to keep in mind. Okay. So when one does a Medicaid application, it is New York Medicaid Choice that processes the application. If someone needs more than 12 hours of care per day, then they will qualify for additional assessments. What I've been hearing is that for most people applying to Medicaid home care, they are receiving like 5 to 8 hours of care per day. Um, and you should be aware that to get to that process of being approved takes a little bit of time. So if you're thinking that you may want to apply for Medicaid, it's good to get started with the process, realizing that it may take a few months. Another thing to keep in mind is that once you're approved, the care won't start until the first of the following month, because of the way managed care programs work. So even if you were approved, say on the 15th or the 10th of the month, the program would actually start the first of the next month. And again, I include some, because in this short presentation here, I can't give you all the info, but Independent Consumer Advocacy Network, which is a part of Community Service Society, as well as New York Legal Assistance Group, are excellent agencies to get more advice on these issues.
Um, when you talk about home care, does that have to be a specific kind of healthcare issue? What if someone's just looking for, companionship, but it's, companionship because it's like a psychological or, social kind of benefit to the person?
So I'm going to be talking a little bit more in some of the upcoming slides, but there are agencies called companion agencies. And I'm going to talk more about what the differences are between a home health aide versus a companion. So one other Medicare benefit to keep in mind is the hospice benefit. And of course, we all know that that is something that people apply for when they're end of life, because one does need to, eligibility is determined by a prognosis of having 6 months or less of life. And the main thing to keep in mind is it really means that the diagnosis, the reason why one qualifies for hospice, will now be something that is only treated by palliative care. In other words, they'll make sure that you're as pain-free as possible, but they won't be providing active treatment for that diagnosis. The benefit of it, and why I say, still good to consider if one is in this situation, is that Medicare provides some home health aide hours. I've heard even of people having 5 days, 4 hours ongoing of services that are completely covered by Medicaid. I mean, by Medicare, rather. And then in addition, there are some additional services like excellent pain management. They have quick access to durable medical equipment, 24/7 on-call physicians, as well as some chaplaincy and social work services. So that can be helpful. Of course, yes, with reason, it keeps in mind, makes for anxiety. I do know, actually, I have someone right now on our program who graduated from hospice and she has been off of it now she was on for 6 months and I think she's been off for like a year now, thank God, doing well. So, yeah. But again, just in light of the fact that there is some further home health aide hours ongoing, it's helpful. So getting back, Matt, to your question, so there are agencies called companion agencies, which provide the benefit of interviewing and doing those reference checks and background checks. But the main thing to remember is that there can be no hands-on care with them. But especially for someone like in the situation you were talking about, where they want some socializations. I mean, I get people who call me and say, "Oh, what I really want is someone who can go to a museum with me, or we go to concerts sometimes and then discuss them." And I'm like, "Well, I don't know that the home health aides are the right fit. My home health aides would be great at helping to take your blood pressure or do hands-on care, but it may be better to go with a companion agency that specializes more in that. There are also registries. These are usually run by individual care managers, and they do provide usually some screening of the aide. Again, they'll interview and do some reference checks, but with registries, you should check and make sure, are they going to be involved on an ongoing basis or not so much? That they're run in different ways. So just important as you're looking into them, to be aware of that. But in both cases here, they're not licensed, meaning they're not under Department of Health, and they're therefore not going to be having nurses who are supervising the staff. So, what that means really is that the personal care, meaning dressing, toileting, bathing, and grooming, are not going to be provided. Even they really shouldn't be helping someone, right, transfer from, if they need to help with transferring and somebody to hold their arm, while they're going from the rollator to sitting down or something, that should not be a companion. It really should be a home health aide. It's sometimes confusing on websites as to whether it's licensed or not, but you can, when you call, you can definitely ask if they're licensed under Department of Health. So the question comes up of how do people know when they need home care, right? And it really is kind of this balance of dynamic in terms of, what are we able to manage in the home? Good to engage family, friends, and professionals to talk about what the benefits and disadvantages are. But if you're kind of the person, the caregiver, trying to decide, also just monitoring, what's your level of frustration, right, with the current situation and what's happening. So some of the ways also, though, that one would know that they need care is if they're having hesitations about leaving their loved one home for alone, or there starts to be more falls or risks of injury, increased frustration where there's, more arguments, possibly leaving. I mean, and this is in worser situations, right? Leaving pots on the stove or a wandering episode. We hear all the time, right? Missed medication dosages or missed medical appointments. And really, the reason I see the most in terms of people requesting care is just changes in mobility and functioning, leading to increased need for help. So, we all have been socialized to think of ourselves not as caregivers, right? They always say if they do a caregiver survey, nobody volunteers to participate, right? Because we think of ourselves as sons and daughters and spouses. Um, Good to, think through. People have very different expectations. I hear all the time of situations where, one sibling, maybe the sibling who lives closer in, is like saying, "No, we've got to get care," and the ones who live across the country are like, "What are you talking about?" So just good to do a just general assessment. What is the safety level? How much stress are we experiencing, and how are we going to be able to manage it financially also, right? Because that's a big piece to this as well. So, ways to introduce home care when someone is a little bit resistant is just making mention of, situations or times when it comes up. We had some recently a woman who came on and her sister was going through some medical procedures that were very difficult, and she really wanted to be able to accompany her, but her husband was really not safe being left alone. So she kind of, started to say to him, I missed that time. I'd love to go in 3 weeks. She has another procedure, and slowly but surely we started out examples of, oh, look at, so and so down the hallway is or next door is using someone who's really good. And then emphasizing the way, if you're the caregiver trying to persuade someone, ways it would be helpful to you. Um, it is hard, especially when somebody is having memory loss. It's, of course, I mean, hard for any of us to admit that uh, being dependent. But even more so when someone is having memory issues, there's going to be even more of a discomfort dealing with unknown people, as well as impaired judgment. So some of the time we kind of have to, certainly respect the autonomy of the person, but also push the envelope a little bit in terms of at least, saying we need to try to give this a try. And so listening, of course, and validating, the concerns, it's one of those services that is so intimate, right? Suddenly you have someone in your home helping you maybe in the bathroom, right? There's just so many issues in terms of privacy, control. So it's really important that we acknowledge that, that to the extent possible, we allow the person still to have the control that they need to also come, weigh in and say, I like it like this, I don't want it like that, is crucial. And I can't emphasize enough, and I'll give an example. We had someone who she started with the companion care. Actually, she was herself very involved with art and art history. So the companion, she went to a companion agency. She started off with someone who knew a lot about, who was an artist visiting, and slowly but surely that person came on a regular basis. And then they came to us and said, well, we'd like 1 day a week of service from you, from a home health aide, because she's beginning to get used to this. And slowly but surely, and also as her long-term care insurance kicked in, we began to do more and more. One other thing we do is to provide just 1 or 2 weeks, temporary care. And that kind of got things started where they saw, oh, this was helpful, that I was able to actually, shower and not be so scared. Um, and but and just always remembering also that the first time we hire someone doesn't have to be the last. I do need to take a break just for 1 second, very briefly. Hold on one moment. Sorry about that. School started for my daughter, but not my grandchildren. So I apologize about that brief interlude. Um, okay. All right. So yeah, and one other thing I didn't mention about that particular case is I actually did the intake on that case, and I was told, don't say the word home health aide. You have to say friend or companion or assistant. And I was like, I'm gonna blow this. Like, but we somehow managed through, and actually it's been working out very well, and we really did do that increase in care. Also emphasizing, those things that for, most people have like all their lives, like it's been more acceptable having a housekeeper, having someone who's just, helping with some shopping, and kind of emphasizing that piece of it rather than the personal care piece can be helpful in reframing the need for help. So the other question I get all the time is, well, this is so expensive. And I'll talk a little bit more about that. Can I just hire the person down the hallway, as I said, or so and so said they had a great person. So I just wanted to talk about benefits and disadvantages in terms of private pay versus having an agency. Of course, one of them is it's all above board, right? Payroll taxes and withholdings are all taken care of. Unemployment contribution is done. And work-related injuries, that there's liability insurance covering it. And this is the type of business where there are quite a bit of back injuries, other falls, other issues that come up. So it's good to have that protection. There is also, agencies have access to, in New York State, to something called the home care registry, where they are able to see criminal background check, even on an ongoing basis, to right away be notified if there is a problem or conviction. We also do verification of license. We can see all the places someone worked, their history, and we go and call and check to make sure that that history is true. So that can be invaluable. Um, the reason it's called licensed again is because it's under Department of Health. Aides are supervised by nurses. So and given orientation and individualized training with a licensed agency, the nurse must come in person to, if an aide is going to be permanent on a case, and orient them in person. And then there's also the backup coverage, right? Every single day, our agency, Concerned Home Managers for Elderly, COME, has backup aides, so that when we get that 6 a.m. call, we are able to get someone else out, and we'll send them by Uber if we need to make sure that they're there on time. And they're required, licensed agencies are required to have on-call aides and nursing staff 24/7. So even if you call at 2 a.m., you will first get our nurse. If you needed a backup, it would probably be me. So backup supervision. But all agencies must have nursing available at all times. And then we always also do have, hopefully we don't need it, but if there's emergency, we have, preparedness plans to deal with that. So what type of what type of training do the aides have when they're certified? We talk, because for licensed agencies, we always have certification. They must have 2 to 3 weeks of full day trainings with a nurse, as well as 12 hours per year, to maintain their certification. Many agencies also ensure that their aides have dementia training. Ours, for example, also we work with the Parkinson's Foundation, and all of our aides do a 2-hour module specifically about Parkinson's disease. But we've also had some training by hospice programs, like MJHS Hospice, on end of life and how to manage that. Because the aides, they deal with a lot, right? They are like front center, the direct care providers. I also get the question, can my private person become a home health aide? So there is certification available. There's many for-profit and nonprofit schools and agencies. There are quite a few home care agencies that will do that training with the expectation that the aide would then work for that agency for a period of time. If you do have someone who said, oh yeah, I had a certificate, or I think I have one, just remember, if they haven't worked under their certificate, in other words, with an agency within the past 2 years, then they cannot use that certificate. They do need to do their training again, and that's the cost. Another thing to keep in mind, though, is the person does need to have all of their working papers in order, and be permitted to work in the U.S., as well as the language skills, to pass that training. So going to the issue of why is it so expensive, and just to give you an idea, so we're $38 an hour. Other agencies, though, I hear anything from 36, 37 to $45 an hour, which can be a bit of sticker shock. Oh, for New York State, the minimum wage for most types of workers is about $16 now, whereas for home care workers specifically, just for that category of workers, it's $19.10 per hour. And that impacts all different types of home health aides, not just those who are with Medicare or Medicaid. Any home care worker, that's the minimum wage. And for the most part, they charge more than that. Again, the agencies will be above that, right? We're at 38 because you're also paying for being able to have the backup aides, the administrative help, and the nursing. Um, so ways to pay for it. For some, they have long-term care plans, which are insurance, which is always was voluntary. Many people were offered the opportunity to buy through their job, um, but many of us don't have them. The one thing to really keep in mind with that is that all of the policies are individualized. So you really should check your own policy to see what's covered. Usually you have to use an agency, a licensed agency, but there are some policies that say it could be just, someone that you hire. But almost always approval is based on how many activities of daily living the person needs help with. And most of them also, and this again is a good reason to check your policy, have some sort of exclusionary period at the beginning. 60 days, 90 days, and they even count the days differently. Like some of them will say, okay, if you use 2 hours per day, we count that as a full day, whereas others have, different definitions. Okay. And you should know many agencies are willing to accept direct assignment of the insurance. In other words, rather than you getting reimbursed by the insurance, that the agency will do that. But even if that's not the case, the agency should be willing to fax or upload to the insurance portal and provide duty sheets to confirm the care was given. Other types of ways to get home care, because I know the ones I've mentioned are a little expensive. There is a program called ISEP, Expanded In-Home Services for Elderly program in New York State, providing some short hours of care. It really is mostly available to those with more limited incomes, and there are sometimes long waiting lists. But again, those case management programs that I mentioned earlier are the way to access those services. And usually it's short hours, sometimes on a short-term basis, but can be helpful because it can be sliding scale. So good if you're above the Medicaid limit, but not too far above to look into that. Some of the things to consider if you do decide not to go with an agency is who's going to supervise the aide, right? Is there going to be backup? Like who's going to be available if you get that dreaded call at 6 a.m.? How are payment, vacation, other job issues handled, as well as, is it possible that you might, if you need it, get some extra training? And many of the agencies like Caring Kind, Alzheimer's Association, others do provide some dementia training for direct care staff. And as I mentioned, like Parkinson's Foundation and other illness-specific agencies also do illness-specific trainings. But consider perhaps it's useful. And I have a lot of people on our program like this now. People will hire us for the harder to fill shifts, right? Maybe the weekend is difficult, maybe overnights. But then when they do need that backup, like maybe Thanksgiving and Christmas, they're going to give me a call, right, in October and say, oh, by the way, can you provide, someone during that time? Or even yesterday, we just got a call. Somebody who uses us for overnight care called at 7 a.m. saying, the private aide just called out. Can you fill in for the day? Which we did. We had our overnight person stay longer, and then we got somebody else there for the daytime. So how do you go about finding agencies? Again, those discharge planners from hospitals and rehabs are helpful. Social service agencies can be invaluable. PSS, the senior centers you go to and others, as well as, some of the agencies that I mentioned. And word of mouth is always so helpful, right? To find out who worked out well for others. Sometimes people hire geriatric care managers, especially if they're far away and are not themselves able to provide the assistance. They can be very expensive, $200 an hour, 175, 225. However, sometimes they can be invaluable if there is nobody else to assist, and they can really help with finding the home health aide, interviewing, managing them, etc. So thinking of, when you do look for an agency, good to consider, are you going to need hourly versus live-in means for 24 hours? What are costs going to be? Mutual care means one aide providing care for two different people in the household. So as you're looking into agencies, think about well, at the agency, who's supervising, right? And what other services or support do they offer? Because they, in addition to training, sometimes I know they'll have special dementia services or others. What happens when urgent issues arise? If somebody calls out sick or takes vacation, and what other trainings, as I mentioned, are provided. Usually the intake will be done by a nurse, social worker, or another agency staff. All agencies have a service agreement, right? They just want to make sure in black and white what everybody is agreeing to. Many of them have a security deposit. For example, we have a security deposit of 1 week worth of service, but we give it back at the end. Sometimes places have 2 weeks. It really depends. Um, Again, it's not going to happen if you're on Medicare short term, but if it's longer term care, you can sometimes ask to be able to interview the aides ahead of time. Again, some agencies charge, we don't. But you're always going to want to know who is that contact person if you have scheduling changes or if there's any problems to troubleshoot. So I urge people to look through the service agreement, know what their policies are about security deposits, and also do they need advance notice if they're going to stop service? That's very important. And you want to know if there's any other fees. Like, for example, under Department of Labor for New York State, the aides were required to sleep 8 hours, 5 hours of which are continuous. And if they don't, you may see a bill for 8 hours of care because the aide will have said, well, I didn't sleep 5 hours continuous. I was up at 2 a.m. and 4 a.m., etc. So good to know about that. Most agencies do have a minimum number of hours per day. So again, these are just all good questions to ask. Um, yeah, and the agreement is usually signed by both. And yeah, you'll just want to make sure that all the payment pieces are clear. All right. So with 24-hour, and I kind of mentioned it already, you have two options, either usually two different aides for 12-hour shifts or one aide for 24 hours of care. So again, that means, that the aide is supposed to get 8 hours of sleep, 5 hours continuous, as well as 3 hours during the day of work-free mealtime if they're doing live-in service. Um, and and again, if the aide is reporting that they haven't been able to, and I've had cases where, for the most part, it all worked okay. And then one night, the person was having GI problems or something, right? And the aide reported, well, I didn't sleep that night. So again, that's when someone would get a bill for those additional 8 hours. But it's just very good to be aware of it. And as well as, and I will say there have been a number of court cases regarding live-in service. I think a lot fewer agencies provide live-ins. So good also if you are getting this service to make sure that you know if the agency has backups if someone calls out sick, or if at that point they're going to say, hey, actually, we don't have any more live-ins, we're going to need to do 2 times 12 because it will be more expensive. Just to give you an example, we charge $4.95 per day for live-in, and whereas the the 2 times 12, 2 different aides for 12 hours. The overnight aide is expected to be awake the whole time. So we do charge for every single hour. Okay, these are just some questions to consider if you are able to interview the aide, asking of why they became an aide, hobbies and interests, but remember it's a job interview. So take care, you shouldn't be asking, how many children do you have? Are you pregnant? Any of those types of questions. And I always will ask people, do they have experience with dementia? Do they have experience with doing transfers? Because just in case, you'll want to know that, yes, they do know how to do that, or you'd be surprised. Even somebody who's worked a few years, I've definitely had them say, oh, I've never had someone with dementia. So just important. Okay. So you want to make sure, right, that personality match, you understand time frames. If if you're the caregiver, you need to be out of the apartment or house at 8 a.m., that the aide really understands that is very important. In terms of aides administering medications, they are allowed to provide reminders, meaning that they can put medications into someone, like they can take them out of a bottle or a mediset and put them in someone's hand. The person has to be able to put the meds in their own mouth, though. So medication reminders, it means, that the aide can really know what's given and when, and make sure that the person is aware, and even to the extent of putting the meds in their hand, but they can't actually put medication in their mouth if they're for some reason too weak to do that or unable. Um, so always, an agency will always do a plan of care. I think it's crucial just to have tasks and expectations set out. Cross training can be invaluable if you have someone who's already worked with you, who really knows the ropes, to help a new person. And I would say if there's two aides who are gonna, hand off one shift to another, doing a walkthrough to make sure everybody's aware of what the environment looked like is very helpful. Also remember that even though you may love your dog or cat, others have cultural, religious preferences, allergies. So when you're calling around to look for care, make sure they are aware. I have a cat, I have a dog or whatever. Dress preferences you'll want to state, and just remember when someone's on home care, even if there's other people in the household, they are not expected to do that housekeeping for the other people. Certainly throwing a little more food in the pan, extra eggs in the pot is fine, but they shouldn't. They're not going to be expected, at least by the agency, to do laundry for others or be helping others or doing housekeeping for rooms that the person doesn't use. And again, just general things of, phone usage. Yeah, definitely can be a problem. They're not supposed to be using their phone during work time. And also make sure, in some instances, someone cannot be ever left alone, even for a short errand. So it would be really important to, make sure that everybody has that understanding. Um, Okay. And the same thing, usually with live-in, the expectation is that the house, that the person hiring provides food. But otherwise, aides usually do bring their own food with them. If it's an overnight shift, the aide is supposed to be awake. So good to think about maybe a baby monitor if they're in another room, or that they're just very close to the person so that they can make sure to hear. So it's a lot of info. I know I'm going to stop for Q&A, but good that you're attending information session like this to know your options and more about the home care system. And one thing I say to keep in mind is that there's changes happen over time, so good to be flexible. And it is an expensive service, but a very needed one. So important that we do the research and understand what's possible. This is my information. which I'm also going to be putting into the chat. We are a nonprofit agency started in 1984. We do provide free social work services to people in addition to the home health aide, and and provide services throughout the 5 boroughs. I'm always happy though to discuss, different situations with people. I'm going to stop sharing now and allow time for questions.
So we have one from Susan Karp. Has the federal government made any recent reductions in Medicaid in terms of eligibility, needing to work to qualify, et cetera?
They haven't yet. I know that yeah, and I know there's a lot of discussion on the table, especially with Medicaid, and changes that are upcoming. I know one thing and again, things haven't gone through yet, but there are federal laws that pertain to domestic workers that I think they're trying to loosen up some of the regulations that protected some of the workers. So it's something that the home care industry is keeping an eye on. But for right now, I can't give further specifics at this point, but we probably will be seeing some changes.
Yeah, anytime we have any Medicaid related subject on our webinars, that's always a question these days. All right, so we'll keep attuned for more information on that. All right, we have another question from Inessa Cruz. Could you please elaborate on what palliative care services offer and how it differs from hospice care?
Yeah, so I think the best way to think about it is that palliative care is the umbrella term for many different services, one of which is hospice. Hospice really usually refers to end of life. Having that, the eligibility really is that 6-month prognosis, whereas palliative care also includes pain management in general, and the idea that the focus is going to be not so much on treatment or providing a cure, and more just really focusing on making sure the person is comfortable and as pain-free as possible.
Yeah, and I might point out that people can be extended on hospice, so that's 6 months can be
Yes.
longer.
Yes, we actually had someone she had COPD and that was end stage 3 years. She was on hospice home care as well as home care with us. And yeah, she just kept getting moved, recertified.
Yeah, President Carter, I think, was in a similar situation. Okay, very good. Um, and I have a question here. When the security deposit is returned, is accrued interest included?
No, that's a good question. But generally, I think it really is just kept as a security for the agency. But again, that's why I emphasize that you really need to make sure about that termination clause in the agreement you sign, because I definitely have heard people come to me saying, I can't stand this other agency. I want to come to you. Oh, but now I realize that they told me I have to give them 2 weeks notice or else they're going to keep the security deposit for 2 weeks, that they had given at the beginning. So again, very important that you keep track of that. And and if you're in a rehab center and applied for Medicaid, do you stay until the decision is made? No, not necessarily. And again, that's another reason why it's really good to have guidance when you're doing a Medicaid application, because there is even kind of expedited applications and other things, but you're not going to know about that without getting some guidance. So again, in the slides, there's some resources listed to go to get help. Thank you.
Take care,
Okay,
everyone.
take care.
Bye-bye.
Okay, all right, bye-bye.